Welcome to The Cancer Signal, a podcast presented by GRAIL, where we discuss topics related to early cancer detection, including multi-cancer early detection, cancer genomics and risk, barriers to cancer screening, and much, much more. I'm your host, Susanna Quinn. Today, we are interviewing my friend, Jody Hoyos, who is Chief Executive of the Prevent Cancer Foundation, the only U.S.-based nonprofit organization solely dedicated to cancer prevention and early detection. Since taking the helm as CEO, Jody has led the foundation in revitalizing its mission and vision and creating a more strategic direction for the foundation's next decade and beyond. As CEO, she has become the foundation's lead spokesperson, championing the 2023 launch of the foundation's signature campaign, Early Detection Equals Better Outcomes, which is what we are going to discuss today. Welcome to The Cancer Signal, Jody.
Thank you, Susanna. I am very excited to be here talking with you today.
Awesome. So tell me, what is the mission of the Prevent Cancer Foundation? And talk to me a little bit about your role as CEO.
Happy to do that. I think the mission of the foundation is probably a lot easier to talk about than my role as CEO, but I'm going to do my very best for you today. The mission of the Prevent Cancer Foundation is to empower people to stay ahead of cancer through prevention and early detection. So really what we're all about is taking the power from cancer and giving it to people. The best way to do that is through prevention and early detection. And I know we'll talk a lot more about that. There are a few different ways we do that at the foundation. And really we focus on 4 different pillars. One is education. So we are what's considered a patient advocacy group. So as you talk to different groups out there, there's a whole group of us that are out there to talk and represent the patient voice. We are a little bit different in that we are a people advocacy organization because we are representing the voice of the general public. We're talking to people before they even have a diagnosis. We want them to go and get screened. We want to talk to people before they even get into a hospital or healthcare setting. So education, that's one, public education. 2 is research. We are a funder of research, and we're working to move forward the field of prevention and early detection, new ideas, innovations that can really be a catalyst in this space. 3, advocacy. So we work to advance federal legislation to make sure that there's access to screening and prevention, that there's funding going to the space that is often underfunded. And 4 is outreach. So we actually want to make sure that the people who need to do the work at the local level have the resources and funding they need to do that. So we operate at a very high level, federal level, and then we're working at the grassroots level, at the community level. My job as the CEO is to keep all of those different initiatives aligned so that we are working across multiple fronts to address the same issue: increasing screening, increasing awareness, increasing funding. There's a lot of moving parts, a lot of different stakeholder groups. And so I'm here to just help our amazing team coordinate and address barriers.
Wow, you fill a very big role. You've got a lot of responsibility. The Prevent Cancer Foundation recently launched a powerful campaign called Early Detection Equals Better Outcomes. What led to this specific focus on early cancer detection?
You know, it's interesting that the foundation, as you know, the Prevent Cancer Foundation has been around for 39 years. And the founder of the foundation, Bo Aldeje, was very forward thinking when she set out then to say, why aren't we talking about prevention and early detection? Why are we not addressing this very upstream aspect of cancer? Because that was back when there was really, treatment was what everyone was clamoring around, as they should be. That treatment is very important, but prevention wasn't there. And still to this day, each of us individually know that early detection matters. We know that it's important, but it really doesn't get the funding. It doesn't get the level of attention as everything else. So that's where we come in. That is why we are focused in this space. It really, this campaign and where we're focused, and making sure that there's dedicated education and information going into this space happened during the pandemic, when it was very clear that there was going to be a reduction in people getting their cancer screenings, a reduction in people going and seeing their care providers and getting routine health care. We also know that issue and people missing their routine screenings was happening way before the pandemic. And it's happening for many reasons other than because of the pandemic. So when we started collecting data to find out exactly what was happening. Why are people missing their routine screenings? What do we need to do to really make change here? And there was really fantastic information that we could use, and making sure that we're addressing this effectively at the community level. And so that's why early detection equals better outcomes was born.
So this is an issue which affects everybody who is likely listening to this podcast.
That's right. And what we found through our survey is that 7 in 10 Americans are behind on at least one routine screening. So 7 in 10, that's the vast majority of people are behind on at least one routine screening. And the number one reason why people cited as being behind, and this was across all demographics, was they simply didn't know they needed to be screened. So we have a lot of work to do.
And we all know that early detection does equal better outcomes. So that's really terrific. Jody, what do you think what do you think some of the common misconceptions or barriers that people face when it comes to cancer screening and early detection? And how are you addressing these changes through your work?
The barriers are interesting, and that's why it is so important to collect data and then to actually use the data. I mean, all of us are seeing data all over the place, but then what actually happens with it? So there's a couple of interesting findings that came out of the work that we did. One was that on the misconception side, one was that people reported that they weren't getting their screenings because they didn't have a family history of cancer. We hear a lot about family history. Family history is important. It is important to know if you have access to that information and to share that with your provider if you have that information. However, the vast majority of people that get cancer do not have a family history of cancer. Like about 10% of cancers are considered hereditary. So that's a barrier. If we're not, I've got my Zoom filter up so high, I don't think anyone can see it, but I have a big scar right here right now. I just went in for my routine screening, skin cancer screening, because the team here puts out so much information on making sure we had skin cancer screenings. I had a little skin cancer spot, basal cell carcinoma. They took that off. And what I heard even from the provider when I got there is, oh, well, you don't have any family history of skin cancer. But that didn't matter. I mean, that's can be the harm of the misconceptions that we need to pay attention to. The second one is that people think they don't need to be screened if they don't have any signs or symptoms. So if they're feeling well, no need to get screened. I feel great. I'm not going to go in for my appointment. So those are two that we make sure and emphasize in all of our messaging, that people go in and get their screenings regardless of family history, and when you're feeling well. Like, that is the time to get your cancer screening.
Exactly. And interestingly, I'm one of those 10% of people who I have the BRCA gene. So my
Right.
cancer was actually hereditary, and I had the means to do it, but I still wasn't getting regular cancer screening. So let that be a lesson to all of us. Um, the campaign emphasizes the importance of routine cancer screening tests. Can you discuss the standard of care cancer screenings that exist today? And we've talked a little bit already about why regular cancer scanning is essential.
Yeah. So the standard of care screenings are really it emphasizes that point of going in and getting screened before signs or symptoms. So you want to do that when you're feeling well. And those are routine screenings um, that can either be guideline recommended or available. So we have 5 guideline recommended cancer screenings at this point. We have, and even I have a hard time remembering this one. So we have breast, we have cervical cancer screening, lung cancer screening, colorectal cancer screening, and prostate cancer screening. So those are guideline recommended. So when, there's recommendations on when you start, how often you should be getting screened. There are also screenings available for oral cancer, which is what should be happening when you're at the dentist's office, skin cancer screening, and testicular cancer. So, it's considering there are hundreds of types of cancers, we don't have a lot of routine cancer screenings, although it can feel like you do when you're having to make appointments for yourself or your family. I also want to mention when we're talking about standard of care vaccinations, because there are 2 vaccinations that we don't want to forget about when we talk about routine medical care to prevent cancer. One is the human papilloma virus vaccination. So that can prevent up to 5 types of cancers. And then the hepatitis B vaccine, which, and hepatitis B is strongly correlated to liver cancer. So those are vaccines people want to make sure that they're aware of.
Oh, great. Thank you so much for that reminder, Jody. We really need to make sure to keep up with our vaccinations. One of the things that I wanted to talk to you about was how multi-cancer early detection testing aligns with your broader mission of early cancer detection.
Yeah, it's a great question. So the multi-cancer early detection tests are really of huge interest to us at the Prevent Cancer Foundation. It is our whole purpose is to make sure that people can live longer, healthier lives through the prevention or early detection of cancer. And you and I talked about that we don't have routine screenings. We don't have screenings available for all the cancers. In fact, we have over about 70% of cancer deaths are due to cancers that we don't have a routine cancer screening for. So
Right.
that's a huge number of cancers and really suffering for people and their families. Multi-cancer,
Including
yeah,
including my cancer,
that's
ovarian
right.
cancer, which is the silent killer. We don't have any sort of screening for it.
Exactly right. And it's frightening for people. Having an opportunity to detect those cancers earlier is a big deal. And so we as a foundation who is entirely focused on this space think it's a very big deal and a very big opportunity. So it fits very nicely in our mission, especially because we don't have a single tumor type or body part that we focus on. We are whole person. And again, tests like this, where you're able to address more than one cancer or detect more than one cancer at once, is very much in line with where we think the future of healthcare is going.
Right. Yes. And just a point of clarification, multi-cancer early detection tests detect a cancer signal, as in the name of this podcast, and it lets us know that we need to go for a diagnostic workup. And full disclosure to our audience, I am a sustaining board member of the Prevent Cancer Foundation, having been diagnosed with late stage ovarian cancer. The idea of early cancer detection and testing was so important. I wanted to join this mission. I had a family history of cancer. And as I said earlier, I wasn't getting any sort of regular screening and was diagnosed with a late stage cancer, which I'm very, very lucky to be sitting in this chair and to have survived and to be cancer free.
That's right. And we're very grateful for that. I mean, it's because those stories are what help drive change.
Right. Equal opportunity is such an important aspect. So, can you tell me a little bit about how the Prevent Cancer Foundation collaborates with healthcare professionals, advocacy groups, and communities to promote early cancer detection awareness and encourage screening participation?
That's a big part of what we do. So one of our strengths is as a convener. Because we represent so many cancer types, and we're looking at this space where there's tremendous innovation happening right now. Um, we have to partner. And in order for anything that we do to benefit the actual people or public, we have to make sure that we partner there too. So there's many different ways we do that. It's through different coalitions that we're on. Um, it's when we are convening groups or we are convening meetings that we're pulling together people from all of those different stakeholder groups you mentioned, and particularly at the community level, providers, the people who would be impacted by anything, by any changes that were made, legislators. So convening groups and being a part of coalitions and activities that are multi-stakeholder groups is a big part of how we do our work.
Great, great. What else are you focused on getting done, and what else is coming up this year for the Prevent Cancer Foundation?
I feel nervous even beginning this laundry list, but there are a couple things I think that might be interesting for people. On September 11th, we're hosting our dialogue conference. It'll be virtual on innovations and what's happening with prostate cancer screening. It's free to attend. It is virtual. So if anyone has an interest in the prostate cancer screening space, that they should register and take the time to do that. They also get continuing education credit if that's important. And then, as you know, on September 25th, we have our big, beautiful annual gala at the National Building Museum in Washington, D.C. So we're very much looking forward to that. And then
Yes, I am looking forward to it as well. I am one of the chairs of that dinner, as well as my friend Jennifer Griffin from Fox News, and we are working really hard to get participation with that event.
Yeah, it's a lot of fun, and it's obviously for a great cause. But I think in this space, it is important for people. It can be heavy. I mean, there's a lot of very what we're doing is serious, and we take it very seriously. And there's also a need for us to come together as a community. The gala represents people from all different industries, many people in the cancer space. And it's really heartening to see people come together and say, we're in, we think this is important. And so that's what the night's all about. Just so everyone knows, we are launching next week our community grants cycle. So for those people doing work at the community level who could use some support in doing that, who are actively trying to get people in for cancer screenings, we will be issuing, I think it should be later on this week, a grant application process, and it'll be themed around patient navigation and screening. So if that's you, take a look at the application that we'll be posting.
Great. So, how can individuals, how can people who are listening to this podcast, how can they get involved with the mission of Prevent Cancer and with the efforts to promote early cancer detection and improve outcomes? What can individuals do?
I would reach out, go to preventcancer.org, take a look at the resources we have. So we have customizable screening charts that people can print out and take with them. We have a quiz people can take and find out exactly what they should be doing. That's a fun way to share information. We have the ability of people to schedule doctor's appointments right there on our website. Take a look what we have and share it. Make sure you share it with your friends and family. Don't hesitate to reach out to us, and myself included, if you have ideas, if you want to be involved, if you're interested in a board position, you're interested in being a grant reviewer, a community grants applicant, talk to us. I mean, that's a big part of how we get better. And we want to hear from you. So, and of course, donate. That is always welcome and always helpful to have as well.
Terrific. Well, you have a very important mission, and you're doing an incredible job. And I'm so proud to be a sustaining board member of the Prevent Cancer Foundation. And not only have I enjoyed working towards helping with the mission, but I've also learned a tremendous amount, and I'm so grateful for that. So thank you for joining us today, Jody.
Thank you very much, Susanna.
You are so welcome. This is the Cancer Signal, presented by GRAIL. I'm your host, Susanna Quinn. Please subscribe to the podcast so you don't miss an episode. See you next month.
The Gallery test is prescription only. The Gallery test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended for individuals who are pregnant, 21 years or younger, or undergoing active cancer treatment. Gallery should be used in addition to routine cancer screening. Gallery does not detect a signal for all cancers. False positive and false negative results do occur. For more information, including important safety information, please visit gallery.com.